Tonight, that San Francisco-based healthcare provider that says it caters to its members is accused of administering vaccinations to its members who aren't eligible.
The city's Department of Public Health says not only is it not giving any more doses to the company called One Medical, but it's also taking back hundreds more. NBC Barry's Terry McSweeney is at One Medical office in San Francisco with the details. How did this happen, Terry?
Well, One Medical agreed to provide vaccines to people 65 and older and some healthcare workers. According to the San Francisco Public Health Department, it failed on both counts. One Medical is a national healthcare provider based in San Francisco that anyone can join for $199 per year. It agreed with the San Francisco Department of Public Health to provide vaccinations to those 65 and older, in-home care providers, and healthcare workers, such as EMTs, dentists, and others who are unaffiliated with large healthcare providers. But tonight, the county health department says it found people had received the vaccine who are under 65 and not healthcare workers. One Medical's response indicates a number of doses were administered to patients who were under 65 who self-identified as Phase 1A healthcare workers but were not in-home support services workers, DPH referrals, or One Medical healthcare worker employees. Because of this and our inability to verify the 1A status of this cohort, DPH has stopped allocating doses to One Medical. Not only that, the health department is taking back more than 1,600 doses from One Medical to distribute to other healthcare providers. One Medical tells us tonight that those whom we have vaccinated within the unspecified number of doses in question from the SFDPH have specifically attested that they were eligible healthcare workers. We had permission from the SFDPH to vaccinate this group, and we're transparent with SFDPH about our process and protocols to do so. In an interview earlier today, before the allegations against One Medical surfaced, its chief medical officer, Dr. Andrew Diamond, told our investigative unit about his concern in general about requiring people to show proof that they qualify to get vaccinated.
A lot of the people who are in most dire need of vaccination really would not have the first idea as to how to upload something. And by being overly focused on that requirement, we risk vaccinating far fewer people than we really need to at this point in time.
One Medical was allowed to retain enough doses to provide second shots to people who already received their first dose, according to the county. In San Francisco, Terry McSweeney, NBC Bay Area News.